We started with a press conference to report the Mumia Liberation Day for July 3rd. That was sent to Cheryl Parker. They have not responded. Their response for us on some level is irrelevant to our declaration of July 3rd as Mumia Liberation Day. We chose this day for us to come together for what is really now 24-hour vigil, in which this is our space. We call it a public health liberation safe space, since there's so much evidence of public health harms of police violence. July 3rd is significant because in Mumia's trial, under the racist Judge Sabo, he was pushing the jury to make a decision before the holiday weekend. Now, I don't actually know if there's court documentation of this, but I did speak with Mumia personally, who noted that there was an energy of rushing the decision before the holiday. Now, understand, that trial has been recognized across the world. Amnesty International is commenting on it as being one in which this racist judge, for which we have an affidavit of Terry Carter, the court reporter, who said, I'm going to help them, where Judge Sabo, she witnessed Judge Sabo saying, I'm going to help them fry the neck. Those were his words. That was the quality of the trial back in 1980. And I think at that time it was 1982. So by July 3rd, they had fabricated the confession, which was necessary to secure the death sentence. It was a completely false fabrication. It involved, quote unquote, remembering the confession months later. And Mumia shares something really interesting. It says if you look at the trial, they inquired how did the discussion of the confession come up, and they were doing an investigation of police brutality, and in the course of convening all the police officers, they specifically asked, does anybody remember a confession? At which point, some of the officers, including the partner, raised their hand. So this was the quality of the trial, and it involved one of the most corrupt precincts in the history of the United States. As noted, they were under federal investigation over the last couple of years because of extortion, tampering with evidence, and rank corruption. And that Philadelphia 6th precinct that arrested him, 1/3 of those officers were subsequently tried, convicted, and served time for corruption. So this was the milieu in which Mumia was being tried. July 3rd was the day when Judge Sabo ushered that jury, that biased jury, not of his peers as required by the Constitution, but a jury that was constructed to kill him. And July 3rd was when he ushered them on to make their decision to allow for the holiday. Well, one of the great challenges about medical care in prison is there's a way in which they will be so negligent that it will violate community standards. Now, we saw that again in a court case regarding his hepatitis C. In fact, the level of negligence is so significant that one could reasonably conclude that they're effectively trying to kill not just Mumia, but all the prisoners regarding hepatitis C. The standards where you'd have to practically be on your deathbed before you get the treatment, violating the very principle of the medications which were to prevent that very standard. They were so aggressive in their defense of that that they literally produced the testimony of a doctor who, when questioned by Mumia's lawyer, had to openly state, that's not my statement. The doctor that statement, they refused, they didn't edit it. He said, I signed that, but I had told them that that was not my statement. They did not submit to the court the proper documentation. I recently communicated with Bob Boyle, the lawyer who's trying Mumia's case, and for hepatitis C. And one of the things he questioned was, when was the last time you told them that? And this doctor said, in the parking lot before coming into court. So this is clear deception on their part. This is the level at which they behave, which is so deviating from proper ethical standards of lawyers that this doctor had to sort of say, let me pull back. I don't want to be a part of that. That's not what I said. So in that case, one could reasonably conclude that they're literally trying to assassinate Mumia Abu-Jamal and have been for all these years, not just in the realm of legal proceedings, but also in the realm of his health care. As it relates to his eye care, we can see deviations from what would be proper community standards, and it's only with our aggressive vigilance that we're trying to control it so that it doesn't go wrong. They're repeatedly documenting at the improper licensing level a decline in vision without taking the necessary steps. Their argument may be that's their standard of care, but it's only with our fighting and vigilance that we get the proper standard of care. Mumia struggles with all of these challenges. One of the things he does is he does the elliptical, and he walks vigorously around the yard. And when he walks vigorously around the yard, there are many people, other people in prison who will want to hang with him and talk with him. And when he does, he lets them know, if you're walking with me, you got to walk at my pace, because this is my exercise. And he's disciplined and rigorous about his exercise. He understands the physiological benefits of sweating as it relates to his skin, as a strategy for maintaining his health, as well as the benefits to his heart. So in spite of the fact that he has multiple medical conditions, he maintains a very rigorous and disciplined physical exercise regimen to offset what is the phenomenon that's called accelerated aging in prison. That is, the severe traumas that cause people to have chronologically earlier deaths.